welcome or welcome back to another session of A Day with your fertility specialist. We love having you here. Thank you for joining us today. We really do appreciate every like, every comment, every click, and every share. On that note, please share this with someone you think would be interested in today's topic. We've been talking about genotype and love and all of that throughout this month. Yes, we're talking about how your genotype and compatibility really does matter when you're trying to build a forever or a future with someone. And today's topic is talking about when or if genotype incompatibility is discovered late. So what then happens? I mean, you've already taken that step and then you're discovering this. So what happens? So yes, if you have someone that you think is interested in this topic, please send it to them, share it with someone, leave a comment, ask all your questions. We would honestly love to answer them. And today, talking with us or explaining a little bit more and giving more of a guideline or a path guide on what to do if genotype incompatibility is discovered late. We have Dr. Jane. Hi, Dr. Jane.
Hi, Joanna.
Welcome. It's lovely to have you here as always.
Thank you,
In
Joanna.
case you're joining us for the first time, Dr. Jane is a consultant obstetrician and gynecologist. So she has a lot of experience dealing with women and couples and, everything around that and your children, everything around the whole family dynamic, basically, because she's at the center of it. So your questions that have been asked and things that you may not have been so aware of, we're going to talk about today. I'm your host, Joanna Damira. So let's get right into it. So, Dr. Jane, discovering genotype late. I mean, we've been talking about it this whole month, how you should know what your genotype is before you get married and all those things. But what happens if a couple discovers that, let's say, they're both AS or one is AS, another is SS, things like that? What can they actually do? What is the risk? What can change at that point in time?
Genotype incompatibility can be a significant source of distress or like anxiety. It could make a couple panic when they discover late, haven't planned your family and done your genotype testing,
Yeah.
and you've already worked out what is going to work, then you discover late. There are a lot of things you can do. Well, first thing is to seek knowledge because knowledge doesn't destroy relationships. From that point, with knowledge, you can make informed decisions. You'll be aware of your options, your reproductive options, how you can go about that part. And from that point, you can consult with your gynecologist. If you also have a geneticist in your locality or where you stay, you can consult one, and also even a hematologist. A hematologist is a doctor trained with blood disorders. I know
Okay.
genotype has to do with a mismatch of the
Yeah.
hemoglobin. So basically, those are you want to get knowledge, then take it up from there and make informed decisions.
Okay, well, I mean, this is already a very good step. If you're already in that situation and you're watching this live, it's like your first step. We're talking a lot about new things on here, and you're getting more information here. Yes, I hope this will guide you better on your next consultation with your doctor, your gynecologist, your hematologist, whoever it is that you decide to see, and you have questions on this topic for. So, Dr. Jane, we've spoken about the whole 25% risk of SS in, when one or two of the couple is a carrier, right? So what exactly does this look like in real life? I mean, it's not everybody that is going to have four children that you can evenly split 25%
Yeah.
through. So what does that actually look like in real life reproductive sense?
Yeah, so what that means in real life means that for every pregnancy is an independent event. So it means that if you, for every pregnancy, there's a chance of having one in four chance of having a child that is AA, or um, a 50% chance, that is 24 chance of having a baby that is AS,
Okay.
then 1 in 4% and 1 in 4 chance of having a baby that is SS. It means SS, an affected child, AS, carrier states, and AA, a child that is unaffected. So every pregnancy is independent. It means that you can have four children that are AA, because it doesn't mean that it has to be four. So you can actually have two children and both of
Both
them will
are
be
normal.
AA.
Okay.
You can have three children, all will be AS. You
Mm.
can have two, that'll be SS. So it doesn't have to do that I have AS before I'm going to have AA. So that's just what it means. Independent event. So you go for this pregnancy, those are the options that you have.
So it's just more like the chances for each pregnancy. It's not like,
Yes.
yes, if you have this, then you're not going to have this anymore, because
Yes. No.
everything is an independent, every pregnancy is an independent event. So, because I've heard this a lot actually, and I know we used to do one diagram like that in primary school, or secondary school, where you join the
The S
A,
and the
yeah, the A
A's.
and the S, the S and the H, and things like that. So you probably think, okay, first, second child, but like I said, this is a lot of knowledge that we're sharing on here. And in case you didn't know about that, this is the reality of it. You can actually have all your kids and none of them be carriers, or all of them be carriers, or all of them be SS. So once this is discovered, once a couple discovers that they're genetically incompatible for one reason or another, what would you say their most immediate consultation would look like, or their most immediate reproductive consultation would look like?
Well, the immediate reproductive that's you want to consult the gynecologist,
Mm-hmm.
and during that discussion, you want to discuss your options. Okay, you want to get knowledge. What are your reproductive options vis-a-vis natural conception?
Mm,
You want to try IVF, PGT.
okay.
Um, what is emotionally or ethically acceptable within the laws of the
True.
community?
Yeah.
You want to discuss all of those things and how you can go about
About
conception.
it.
Of course, knowledge, they say, is power.
Yeah, that's true. But what if a couple is already expecting, they're already pregnant, and they want to know, like they found out, yeah, okay, we're genetically incompatible, but you still go ahead with the pregnancy, and you want to know what the outcome of that pregnancy would look like. Are there any diagnoses you can beforehand, to find out?
Yes, there are a lot of tests to go and do. That's also an option in your
Mm,
discussion with the doctor,
yeah.
and you call them prenatal testing.
Okay.
So there are different forms. We have what we call the CVS, chorionic villus sampling, just
Mm-hmm.
taking a portion of the placenta, and you're able to run those tests. There's also and that can be done between 12 weeks, from 12 weeks
Mm-hmm.
of the pregnancy. So it means you can pick problems early
Earlier,
and
yeah.
take informed decisions. There's also what we call amniocentesis. This is done between 15 weeks and 20 weeks.
Okay, so a
And
bit
this one,
further.
you take fluid, the baby's water, what we
Mm.
call, yes, the baby's water, and run some
Where
tests.
the
Then,
baby is swimming.
yes,
Okay.
then we now have the other one, what we call the non-invasive prenatal testing, where you take there are some parts of the baby's DNA that are swimming freely in the mother's circulation.
Okay.
So once you take the mother's blood, you can
Hmm.
actually run some tests on that. So we call that a non-invasive. You see, these two I mentioned, you are
We're
taking
quite
the
invasive,
placenta, you
yeah.
are taking the baby, so they
Baby
are
swimming.
invasive.
Hmm.
But this is non-invasive. You just take the sample, run some tests. This can be done from also the ninth week
Mm.
of the pregnancy, and all those can actually give you an outlook. Are we expecting a baby with SS, AS, and AA? And from that point, you can counsel the couple appropriately.
Wow. I can imagine what it would be like though. I mean, we would want the best out of every outcome, but we're being realistic and scientific. If you do have that situation where, you tell the couple that your baby actually is a carrier or they're SS, in your experience, what are some of the reactions to it, and how do you reassure your patients going forward, based on the pregnancy and the outcome of taking care of that baby?
Well, most times, for a couple to come to the point where they even get to screen,
Mm-hmm.
it means they have knowledge,
Yeah.
they have an understanding of the problem. Yes, a lot of time they are hopeful, they're expectant that it doesn't go the other way.
Mm-hmm.
But the mind thinks of the good and the bad.
Mm,
So yeah,
true.
sometimes they are not excited, but surprised not a lot because it's something they expect could be something an outcome of what they are
Mm,
going for.
mm-hmm.
So yes, they might not be as happy or excited, but it's something they expect. So the reaction is not usually intense like you
Okay.
would expect for someone that doesn't even have
Have an
knowledge
idea,
at all.
yeah.
Yes.
That's interesting. Well, I know you said, we have the invasive testing and then the non-invasive testing. And when we say invasive, I can imagine how it goes in a lot of people's heads. Already coming to the hospital is a big no-no for a lot of people. They would rather not do it. And then you're telling them, oh, if you have this genetic incompatibility, you might have to do something invasive. So I would say, how do you reassure your patients? Do they want to know what the risks are? And in such case, actually, what are they? How safe is this? How successful are all these procedures that we do? The two you mentioned, I remember you saying
Yeah,
invasive.
so those tests, they are very the accuracy is very high.
Hmm.
So we have up to 99% accuracy
Wow.
for the CVS and amniocentesis.
Hmm.
The cell non-invasive prenatal test also has an accuracy of up to 95%. So they
That's
are very good tests.
yeah.
Yeah, so yes, but for the invasive test, so we have the invasive test, as we said, some risk you can have because you are introducing something where, yeah, so you could have an infection, risk of
Okay.
infection, risk of pregnancy loss,
Hmm.
miscarriage, and also the baby's water might even break from
Okay.
that point. Yes.
Wow.
So, but the risk of pregnancy loss is is minimal.
Hmm.
But again, it's important that people know that that risk exists, but it's almost non-existent. Zero point
Yeah.
0.1 to 0.3.
Oh wow,
Yeah, so
that's
it's
really,
quite low.
yeah. It's not
Yes,
even up
but
to a single digit. Hmm.
but it's important we know that it exists.
Okay, so well,
Yes.
how would you would I say prevent this? What kind of things are to be done, or is it based off of where it is done or who does it? How can you actually prevent those risks that may come up?
Well, those for infection, basically, when you want to prevent infection into any condition, any procedure is standard.
Mm-hmm.
Infection prevention steps should
Yeah.
be taken. That
Mm-hmm.
helps take out the infection part. Sometimes after a procedure, you might want to cover them with antibiotics. Depends on what you did.
Mm-hmm.
Sometimes when you carry a procedure, you understand the technicalities, the difficulties, and the challenges you faced along the line. Then I think basically then for the infection and miscarriage risk, well, it's not it's quite low,
Yeah.
so it's not always expertise dependent,
Hmm.
but it's something that might just occur. But again, when you are taking, there are some little techniques
Are
that
you
when you
doing?
apply,
Hmm.
you're a lot better for. And of course, those procedures are very highly technical,
Yeah.
so it's not always left for anyone to do. It has to be done by the best hands,
Yeah.
people that understand what is at stake, and also go for it as they will do it perfectly.
Okay, well, I was asking this question because I know someone out there who's probably thinking, you're saying there's a risk of this happening, and this sounds very intense and very scary. But yes, like she said, you take steps to prevent that. There are techniques that are carried out, there's expertise involved in that. So, and then based on the accuracy of this test, I know it's very important that if you do find yourself in that situation, you actually try to figure out what the future of your child already looks like before them even coming. And I know we spoke about other options when it comes to a couple finding out their genetically incompatible, especially reproduction, and you mentioned IVF. So in what case would you say that IVF can come into play with a couple that is not compatible genetically,
Okay,
genotype?
so once you get a couple that have this genotype incompatibility that want to avoid SS babies,
Mm-hmm.
that's where the IVF. Did you mention IVF PGT?
IVF, yes, but I'm
Okay.
sure PGT also is
All
like
right.
a
So yeah. So in
parallel.
what cases do just IVF and
Yeah,
PGT? Yeah. So
yeah.
people that don't want to have SS babies can go for IVF. Now it depends on type of IVF. You can, if the couple wants to use their own gametes, so the PGT has to come in.
Mm-hmm.
If of course financial if you're not financially able, you can also consider options of using donor gametes,
Yeah.
either use donor sperm or donor eggs.
Mm-hmm.
So those are options you can have for IVF.
Mm-hmm.
Of course, couples too who have had previous SS child and want to avoid it.
Mm-hmm.
Yes, then there are also people that cannot withstand the emotional trauma of terminating a pregnancy.
Yeah.
So they want to avoid having an excess child
Mm-hmm.
entirely. So those are people that could go for the IVF treatment and all. Yes. Then also there's also the option of intrauterine insemination. Same
Mm-hmm.
thing for with donor eggs or
Okay.
donor sperm. Donor sperm preferably because it's the woman's egg that will be stimulated rather. So you use
Yeah.
donor sperm,
All
yes.
right. So that's interesting. Oh, we actually have a comment on here. Someone asking for joining our live. Talking about PGTM when it comes to all of that. I don't know. I actually haven't really processed all of that, but there's so many acronyms that I know. I know the last time I spoke about PGT on here related to genotyping, we actually had a lot of those initials in this case. So I'm getting the more accurate question. Thank you, Yabakujo, for joining. They said, what about IVF with PGTM? This is something professionals should be talking about to patients as it is a possibility to have a child. So I know we
Yes,
just
so
mentioned, yeah,
yeah, so
PGT.
PGT is also one of the we mentioned it together with the IVF.
Yeah.
So PGT is very important because 100% takes out the risk of sickle
Hmm.
cell and other genetic disorders.
Mm-hmm.
So you are sure of what you're transferring, either the AA or AS genotype, depending on what the embryos you get, and avoiding transplanting the SS embryos.
Okay, so
Because PGT
basically,
has to do testing the embryos
yeah.
before transferring
Mm-hmm.
them.
So this is I would you say this is one that is 100%.
Yeah, this is 100%.
Okay. Well, Yabakujo, I hope that answers your question. Yes, you actually will still talk to your clients about it, especially if they're going into the IVF part of trying to conceive and they're trying to totally eliminate the possibility of, having an SS baby or a carrier. Yes, PGT, IVF with PGT is something that is encouraged or spoken about and, mentioned at least so your patients will have a better idea and make that informed decision that we always talk about. So yeah, I think we've already answered this question. I had someone else trying to ask if a fetus is diagnosed with SS during pregnancy, what options are available at that moment?
The options available are very importantly, they should be counseled on the
Mm-hmm.
options. Yes, they can decide to continue the pregnancy, but they will understand the risk that the child tend to face
Yeah.
in future.
Mm.
Then that they also have the option of termination, again, depending on the local laws of
Yeah.
the country. But again, it's a medical condition, and I
Condition.
think they can actually terminate
Mm.
if they decide or they are emotionally willing to
Ready.
do
Yeah.
that. Yes.
Oh, okay. What if they're not?
So yes, so the job of the healthcare professional is not to insist.
Yeah.
You let them understand what is available, options available,
Mm-hmm.
what can be done, and let them take a decision. And that's where we say informed decision. They become intentional about their reproductive.
Or would rather not terminate pregnancy at that point. How would you encourage them to prepare for the birth of that child? Because I know this is from personal experience. I have a very close family friend that is a sickle cell patient, and she had a twin, and it was a very long difficult ride even up to now. There are other organs that are being affected and things like that. So even from the very beginning, from the very first stages of birth and even up until the baby growing up, how would you encourage your patients to prepare for having a child with SS?
Well, emotional preparedness is very important.
Mm-hmm.
They understand the risk, the health risk the baby, the child's bound to face. Then they should have the baby in a place or in a town, a center where there's a good pediatrician that will take
Mm-hmm.
it up. They can also, things they can do, prepare to confirm the test. The child should be enrolled in a sickle cell clinic where they are followed up, and they can be placed on some drugs that help prevent sickle cell crisis. The parents are supposed to be educated on what those crises early.
Yeah.
Yes, because their crises as they grow, they are different. They talk
Mm.
about dactylitis, swelling of the fingers, and all those
Mm.
things can be picked very early.
Okay.
So they understand some of these things and they're able to pick them before they can now present in the hospital for
Mm.
expert care.
That's nice. That's actually a good way to have that preparedness in case you are in that situation, and maybe morally, ethically, spiritually, or even personally you just find it difficult to terminate a pregnancy, or other options are just a no-no for you. You have to be prepared for the life that you're about to bring into the world, and how you're going to take care of that baby. So, how would you say that modern sickle cell management has actually improved fertility or pregnancy outcomes in general?
Modern sickle cell, come again?
Management, yeah, like managing sickle cell in general. Has it actually improved fertility? I know, we talk about bone marrow transplant, things like that. Does it improve any chances of, I don't know, your
Well, I
pregnancy
get
or
you.
your
I get
journey, yeah,
you.
in general?
Well, modern sickle cell management, yes. Over the years, we have seen a lot of children survive sickle cell beyond childhood stages.
Mm-hmm.
They've gone to adulthood, get pregnant, get married, and all. Now, fertility, coming to fertility,
Yeah.
yes, they're able to get pregnant, yes, because of all those they're able to get pregnant, but a lot of those risks with pregnancy and sickle cell,
Hmm.
they still exist for them. But it has helped them to achieve adulthood,
Hmm.
gotten to those stages of life like every other person,
Yeah.
and not just have them die very
Yeah.
young and early. So yes, modern care has helped them grow to the
Okay, so they
point.
still, it just basically improved life expectancy,
Yeah.
and pregnancy outcomes also being improved. However, they might still have challenges based off of the fact that they're already sickle cell patients. But I know that this is not to discourage anyone out there. And yes, science is moving in such a way that we're trying to improve life every day, improve lives every day. So in case you're out there and you're thinking, oh, my child is SS, I want to see my grandbabies, I want to see my children's children, this is just to encourage you that yes, things are actually improving, but you just have to be realistic and think about the fact that there are other complications involved in it, apart from the fact that pregnancy can be achieved, fertility can be achieved, life expectancy is increased. Also, yes, from your perspective, yeah, as a healthcare professional, as someone who deals with couples every day, or pregnant women and delivering children and all of that, how what would be your, I say, strongest or most important advice, the first thing that comes to your mind that you would want to advise or give as a medical personnel couple that is genetically genotype incompatible?
Well, my first advice is to tell them not to panic.
Mm-hmm.
They should first seek knowledge and get the right information, consult with the experts where they are informed about the options they have, either natural conception, prenatal testing, IVF, PGT options
Mm-hmm.
which are available, and at that point make informed decision.
Yeah.
So it's genotype incompatibility is not any form of moral failure. It's a biological condition that can be well managed, and that should be the start of making very good decision about our reproductive future.
Oh, that's nice. I mean, you sound very calm and reassuring. I definitely would want to hear that from my medical professional, my doctor, whoever it is, just so I'm not discouraged completely. Because I know that a lot of the times, the very stern thing, like, oh, if you're already genetically compatible, don't do this, don't do that, don't do that. But like we've said throughout the course of this conversation, there are options that are available to you. And we just pray that it's something that you think about and make the right choices for yourself and for your baby, your future, and your family in general. Because having to deal with a family that a child that carries the sickle cell genotype can be very difficult and can be very tasking. And yes, sometimes it's unavoidable, maybe in your social situations, or wherever it is that might put you in a tough spot. But we hope that this just informs you a little bit more and you are more comfortable making, your decisions, your informed decisions, because you have more knowledge on the topic. Thank you so much, Dr. Jane, for joining us. It's always a pleasure to have you here and to talk to our dear viewers about all the new things that we have going on. It was good to have you. And
Thank
for
you.
you all out there, thank you for sticking with us. Thank you for staying until the end of this session. We hope that you join us in all our other future sessions. We have these every Wednesdays and Fridays by 3 p.m. on Instagram, on Facebook, on YouTube, TikTok, everywhere. You can drop your questions, your comments, whatever it is. We would really love to answer them because, like I said, we're just trying to give you more knowledge so that you can make stronger, better informed decisions as you go on. If you have any questions, like I said, put them in the comments down below, and you can always walk into our facilities here in Jos and Abuja. Have a lovely day. See you next time. Bye.
Alps Hospitals podcasting when hope feels far away and questions fill the night.